Hey everybody, so today we want to talk about a little thing that we talk about with all of our patients that come in for hormones. One of the biggest things, and there's still kind of a fear factor involved with doing hormones, leads back to this study that was done by WHI, which is the Women's Health Initiative, and it was a study of about 3,000 women that were taking synthetic hormones. They stopped this study, which eventually led to the stop of doctors prescribing hormones for patients because there seemed to be an increased risk of cancer that was developing or had developed during the study in one of these 3,000 women. So we look at that study on synthetics, and we want to talk a little bit about how bioidenticals are different than synthetics and would that outcome have been different if that original study would have been done on bioidentical hormones.
Luckily, now there is a lot of data on the bioidenticals, and we've seen firsthand the safety of bioidenticals. And Sarah and I have been prescribing bioidenticals now for almost 20 years, and we don't see any increased risk in any of the diseases associated, especially cancer. One of the things to point with the WHI study is that really the leg that increased the risk of cancer was the medroxyprogesterone, which is the synthetic progesterone, which is not a progesterone at all. It's a progestin, the kind of hormone that you find in birth control pills. There is data stating that those hormones, including the ones in birth control pills, do increase your risk of cancers. With bioidenticals, we are working with bioidentical hormones, plant-based, identical to what the body produces, and there is no increased risk in those hormones.
Yep. There's been over 20 years of studies done on bioidentical hormones now on over 68,000 women. So we can speak to the safety ourselves of what we see in our practice, and safety also comes from having a practitioner that can monitor those hormones safely and know what ranges are safe for any type of perimenopausal, premenopausal, postmenopausal female. We also have found in that 20 years of research with bioidenticals that the things that they originally saw with synthetic hormones, that maybe heart factors increased and increased risk for breast cancer, that those things actually decrease with women if they start hormones earlier, like in perimenopause. So below, we're going to attach some of that data so you can see it for yourself as well. And always the best way to go about wondering if a hormone is safe for you is to call and talk to a practitioner or call us here at Iconic Health, and we are happy to get you set up with that.